Okay, team. We just have a few minutes before you all have to start rounds, so we've got a new story this week to kick things off. As you're listening, be thinking of how workload spikes, handoffs, and human errors can potentially contribute to patient harm here on our unit. Here's the story.
Chad Carlson had been struck by a car while riding his bike and broke nearly every bone in his body. His lungs were so badly bruised that during surgery to repair his femur and pelvis, his left lung collapsed and he went into severe respiratory distress. The trauma team had to swiftly conclude the surgery and move him to the ICU. Chad was placed on a respirator at 100% capacity and heavily sedated to induce a coma until he could breathe on his own. Within a week, they had reduced his ventilator setting down to 70%. At the evening brief, the day nurse, Diane Sanders, was detailing Chad's condition to the incoming night nurse, Carol Moore. Another patient on the unit coded just as she was beginning to discuss the doctor's order to move the ventilator down to 60% if Chad was stable. Everyone dropped what they were doing and ran to assist. An hour and a half later, when Carol picked Chad's chart back up and reread the notes, something didn't add up. She called Diane on her cell and questioned the doctor's orders. It appeared to her that he was increasing the meds tenfold. That simply couldn't be right. Diane concurred. She said, "Let's get the doctor on the line." When they tracked him down, he said, "You're sure that's what I wrote?" She replied, "Afraid so, Dr. Jackson." He was quick to admit the mistake, saying, "I must have been distracted and forgot to put in the decimal point." "Good catch. Thanks." Carol was gracious. "I was certain that that's what happened, but figured I should just check with you to be doubly sure."
All too real, huh? So, what might we learn from this story? And what's the one thing you think we should work on this week to improve the safety of our patients?
Story care. It's that simple. Just 15 minutes of huddle time every week encourages teams to zero in on behaviors they can easily add to their routine. These become their best practices. They own it, which is the key to organization-wide transformation.